Hello viewers, welcome to my channel. It's the part 2 of the video where we will discuss the pediatric medical doses. The drug is chloroquine. It is also an anti-malarial drug. Let's check it out. It is an anti-malarial, also has anti-inflammatory effects, uses treatment and prevention of malaria. Sometimes used in autoimmune diseases, rheumatoid arthritis, lupus. Mechanism inhibits parasite growth by interfering with heme detoxification in red blood cells. Side effects: GI upset, retinal toxicity, headache, itching. Caution: regular eye exams needed for long-term use due to risk of retinopathy. The dose of chloroquine: it comes in tablet form, which is 250 mg, and the syrup form, which is 50 mg per 5 ml. The first dose is 10 mg per kg, and the second dose, which is given 6 hours later, is 5 mg per kg, and the third dose is same for after 24 hours, and the fourth dose is 25 mg again after 48 hours. So it's 3 days and 4 doses. Next is acyclovir. It is an antiviral. It is an antiviral nucleoside analog, uses herpes simplex virus, HSV1 and 2, varicella zoster virus, chickenpox, shingles. Mechanism inhibits viral DNA polymerase, stopping viral replication. Side effects: nausea, diarrhea, headache. Rare kidney toxicity. Forms: oral, IV and topical. The dose of acyclovir IV is 10 mg per kg per dose or 30 mg per kg per day TDS. Injection formulation is 500 mg per 20 ml, oral 20 mg per kg per dose, 6 hourly. Syrup is 200 mg by 5 ml. Next is flagell, which is metronidazole, which is also a very common antibiotic. Here we will see a short summary of this medicine. Class: antibacterial, and it is also antiprotozoal. Uses anaerobic bacterial infections, protozoal infections, amoebiasis, giardiasis, trichomoniasis, bacterial vaginosis, Clostridium difficile. Mechanism: forms free radicals that damage DNA in microbes. Side effects: metallic taste, nausea, GI upset, disulfiram-like reaction with alcohol. Rare neurotoxicity with prolonged use. Forms: oral, IV, topical and vaginal. So it makes free radicals that damage DNA in microbes. The dose of metronidazole IV is 10 to 15 mg per kg per dose, and injection is 1.5 to 2 cc per kg per dose. Its infusion is 500 mg per 100 ml. It comes in only one concentration and dilution. Oral dose is 30 to 50 mg per kg per dose, and the syrup formulation is 200 mg by 5 ml. Some brand names are syrup, flagell, metrozine, intamizole. For age less than 1 year, half tablespoon TDS, and for more than 1 year, 1 tablespoon TDS. Next, the dose of cough syrup, which is less than 1 year, it is half tablespoon TDS, and for more than 1 year, it is 1 tablespoon TDS. Next, we're talking about multivitamins, appetizer syrup like polymalt, 4-OB12, trimetabol, these kind of syrup, appetizer and multivitamins. Again, for less than 1 year, it is half tablespoon OD or BD, and for more than 1 year, it is 1 tablespoon OD or BD. Antacid like syrup, alsanic, mucane, which are used for uh, gastric burning, acid reflux, GERD, for these kind of conditions for heartburn. And the dose is for less than 1 year, it is half tablespoon, and for more than 1 year, it is 1 tablespoon TDS. Next is antipyretics, very commonly used, paracetamol. The dose of paracetamol is 10 to 15 mg per kg per dose, which is almost 1 cc per kg per dose, 4 to 6 hourly. Ibuprofen or deoxybuprofen or mefenamic acid, the dose is 5 to 10 mg, which is little less than paracetamol, and which is given 8 hourly. So paracetamol is given 6 hourly and ibuprofen is given 8 hourly. Remember that. Now we are going to talk about some brands name and formulations. So Panadol drops 80 mg per dropper, syrup Calpol, syrup Tempramine, syrup Calpol 6 plus, which is double dose, syrup Panadol, syrup Panadol Fold, syrup Brufen, syrup Tersica, syrup Brufen DS, syrup Dologen DS, and syrup Coldrex. Coldrex also has dextromethorphan. We will talk about it in some other video. Next, injection Provas, which is paracetamol, comes in 1 gram per 100 ml, and ibuprofen is 400 mg per 100 ml. Diclofenac, Dicoran painkiller, 2 to 3 mg per kg per day. It is either given in BD or TD. It is given intramuscularly. Next is Toradol, Ketorolac. It is again an NSAID painkiller. The dose for Ketorolac is 0.5 mg per kg per dose, 30 mg per 2 ml. This is the formulation. Next is Nalbin or Kins, which is nalbuphine, which is opioid. The dose is 0.3 mg per kg per dose, and the injection is 10 mg per ml. Next is morphine. Again, it is opioid. The dose is 0.1 to 0.2 mg per kg per dose. Injection 2 mg per ml, subcut or IM. Next is ranitidine. It is H2 receptor blocker, and the dose is 1 mg per kg per dose, and formulation is 25 mg per ml, and the oral syrup name is syrup peptinil, which is 75 mg per 5 ml, and the dose for this is less than 1 year, it is half tablespoon TDS, and for more than 1 year it is 1 tablespoon TDS. Let's check it out. It is H2 receptor blocker, as I have told it, which is antacid. It is used in peptic ulcer disease, GERD, Zollinger-Ellison syndrome, which is recurrent peptic ulcers. Mechanism: block H2 receptors in stomach, reduces acid secretion. Side effects: H2 receptor blockers has more side effects than PPIs, so keep that in mind. The side effects are generally well tolerated: headache, constipation, diarrhea, rare liver enzymes changes, blood count changes. Withdrawn in many countries due to concerns about NDMA contamination, a potential carcinogen. Next, the drug is famotidine. Famotidine is again H2 receptor blocker, uses GERD, peptic ulcer disease, Zollinger-Ellison syndrome, blocks H2 receptors on gastric parietal cells, reduces stomach acid production, side effects headache, constipation or diarrhea, dizziness. It is more safer than ranitidine. That's useful information. Famotidine is better than ranitidine because of less side effects. The next drug is Ulcerex cimetidine, which is again same thing, and the dose is 15 mg per kg per day, and the formulation is 200 mg per 2 ml. Next is omeprazole PPI, very commonly used now even in children. The dose is 1 to 3 mg per kg per day, and the formulation of injection is 40 mg per 4 ml, and the capsule dose is 10 mg for less than 20 kg weight, and for more than 20 kg weight is 20 mg per kg. The next is gravinate. It is used in nausea, vomiting or gastric conditions. Dimenhydrate, very commonly used in pediatric setups. It is antihistamine, antiemetic, so it is dual purpose drug. It is used in motion sickness, nausea and vomiting, and vertigo, mania disease. Very helpful. Mechanism: blocks H1 receptors and has anticholinergic properties, suppresses vestibular stimulation. So it blocks H1 receptors and also has anticholinergic properties. So it suppresses vestibular stimulation, so that's why it can help motion sickness. Side effects are drowsiness, dizziness. It's interesting, it's used to prevent drowsiness and dizziness too, but the side effects can cause the same thing: dry mouth, blurred vision, constipation, urinary retention, anticholinergic effects. The dose of gravinate dimenhydrate is 0.1 to 0.5 mg per kg per dose. Formulation is 50 mg per ml. And we also have syrup gravinate, which is 50 mg per 5 ml, half tablespoon less than 6 months, and 1 tablespoon more than 6 months. Next is injection onset, ondansetron antiemetic, again very commonly used for vomiting and nausea. The dose is 0.2 mg per kg per dose, and the injection formulation is 4 mg per 2 ml or 8 mg per 2 ml. The quick way to find the dose is add 0.0 in the weight in kg. Like if the weight is 20 kg, the dose will be 2 cc. And syrup dendron, in syrup the dose is 4 mg by 5 ml. Next is Avil. It is given in allergic reactions to medicine. Avil is pheniramine. It is first generation antihistamine H1 blocker. Uses allergic conditions, itching, insect bites, sometimes used for cold symptoms. Mechanism: blocks H1 receptors, reduces allergy symptoms. Side effects are drowsiness, sedation, dry mouth, dizziness, rare palpitations or confusion. The dose of injection Avil is 0.7 to 1 mg per kg per dose, and the formulation are 25 mg per ml or 50 mg per 2 ml. Next come the steroids. The first one is solocortif, which is hydrocortisone, which is very commonly used in conditions like shortness of breath. tachypnea, respiratory distress. Let's have a brief summary. Hydrocortisone, short summary, class corticosteroid. It is glucocorticoid, uses inflammation, allergic reactions, adrenal insufficiency, autoimmune diseases. So yeah, it is used in Addison disease where there are decreased cortisol. The mechanism, it mimics cortisol, suppresses inflammation and immune response. Side effects: weight gain, fluid retention, hyperglycemia, hypertension, skin thinning, long-term use, osteoporosis and adrenal suppression. These are very important to know. The dose is 10 to 15 mg is the loading dose which is given in stat, and then 5 mg per kg dose is 6 hourly, and in oral the dose is 10 to 15 mg meter square. So you go to check it out. Next is injection decadron, dexamethasone, or we call it injection dexa. The dose is 0.6 mg per kg per day. It can be given 4 times or 3 times. For 2 days, 1 to 2 hours before dose of antibiotic, 6 hourly. The formulation is injection 4 mg per ml. Next is delta coltyl prednisolone. Again, very important and steroid. The dose is 1 to 4 mg per kg per day. The tablet is 5 mg and the syrup is 15 mg by 5 ml. Next is fludrocortisone, which is the brand name is Florinef. The dose is 0.05 to 0.2 mg per day. Tablet comes in 0.1 mg. This is not very commonly used. Corticosteroid, mainly mineralocorticoid activity, uses adrenal insufficiency. Sorry for that. Congenital adrenal hyperplasia, orthostatic hypotension, which is an off-label use. Mechanism mimics aldosterone, increasing sodium and water retention, promotes potassium excretion. So it's given in Addison disease when aldosterone production is less, and it promotes potassium excretion. Side effects: hypertension, edema, hypokalemia, headache, weight gain. The dose we have already studied. Next is mannitol. Mannitol is given in cerebral edema. It is an osmotic diuretic, uses cerebral edema to increase intracranial pressure or acute glaucoma to decrease intraocular pressure. So it's given in 2 conditions commonly. Promotes diuresis in the acute kidney injury. Mechanism: increases osmotic pressure in renal tubules and blood vessels, draws water out of tissue into urine. Side effects: dehydration, electrolyte imbalance, pulmonary edema. The dose of mannitol is 10 ml per kg per dose, that's loading dose, and the maintenance dose is 5 ml per kg per dose. Next is injection diamox or acetazolamide. It is also an diuretic, carbonic anhydrase inhibitor. So we have to remember that, I guess. uses glaucoma, altitude sickness, pseudotumor cerebri, idiopathic intracranial hypotension, metabolic alkalosis. It has many multiple uses. It inhibits carbonic anhydrase as given in the name, increase renal bicarbonate excretion. Oh, so that's how it can help in alkalosis because it increases renal bicarbonate excretion. So when bicarbonates are excreted, alkalosis will be treated and our pH will shift towards acidic. It is diuresis and metabolic acidosis. Side effects: metabolic acidosis, hypokalemia, because it can cause potassium secretion too, tingling, kidney stones, alpha allergy risk. The dose of acetazolamide is 10 mg per kg per dose and is given TDS. The tablet for strength is 250 mg. Next is dopamine. We all know what is dopamine. It's a neurotransmitter in brain. It is inotropic agent, vasopressor, catecholamine, uses shock, cardiogenic or septic shock, heart failure, short-term sport, bradycardia in some emergency settings. Mechanism: increase renal perfusion, dopamine receptors, moderate dose, increase heart rate. So the thing is, dopamine has different effects in different dose. If we are giving low dose, it will increase renal perfusion. So by acting on dopamine receptors. If we are giving moderate dose, it will increase heart rate and contractility, beta 1 receptors. If we are giving high dose, it is causing vasoconstriction, alpha 1 receptors. So to get the desired result, we will have to manage our dose according to that. Side effects: tachycardia, arrhythmias, hypertension, tissue necrosis. The dose of dopamine is 2 to 20 microgram per kg per minute or 6 units per kg, and the injection formulation is 200 mg by 5 ml. How to calculate weight into dose into 8 into 60 divided by 1000 and then divided by 40. Let's calculate. So let's suppose there is a 10 kg child, right? So 10 into dose, which is 2 to 20 microgram. Let's take 2. 10 into 2 into 8 into 60. 10 into 2 into 8, because it was in minute, and then 8 hourly, we give it 8 hourly. That's why we're using 60 to make it hourly and 8 to make it 8 hourly. So yeah, now we will divide it by 1000. 9.6, and then we will divide it again by 40. 0.2. So the dose of dopamine for a 10 kg or 10 kg weight child will be 0.2 cc. Keep that in mind. Yeah, for renal dose is 5 microgram, for cardiac dose is 10 microgram per kg per minute, and for vasoconstrictive effect the dose will be more than 50 microgram. As we have seen that to get the desired result, we need to give the dose accordingly. The next is dobutamine. Again the dose is 2 to 20, strength is 250 by 5 ml. Again the same formula will be used, dose into weight by 8 into 60 divided by 1000, and the answer will be divided by 50. So in the case of dopamine it was 40, but in the case of dobutamine it is 50. Next is adrenaline, very important drug. It's a life-saving emergency drug. Everyone should know about it, everyone. Adrenaline, epinephrine. Norepinephrine. It is class catecholamine sympathomimetic. Uses anaphylaxis, shock, cardiac arrest, severe asthma attack, or it is added to local anesthetics to prolong effect. Mechanism alpha 1, if it acts on alpha 1 it causes vasoconstriction. In beta 1 increase heart rate and contractility. Beta 2 bronchodilation, decrease allergic mediator release. So it has 3 effects, and these all are very common, and this drug saves life. The side effects are tachycardia, hypertension, anxiety. So it's very important to know the dose of this drug, because overdosing can be very lethal. The dose is 0.05 to 0.3 microgram per kg per minute, or you can just say 0.1 to 0.3 ml per kg. So if 10 kg old baby, the dose will be 1 ml. And let's see, 0.1 mg per 1 ml, it means 1 into 10,000 dilution. And if it's 1 mg per 1 ml, then it 1 into 1000 dilution. And the formula is weight into dose into 8 by 60 and 1 by 1000. Now come the noradrenaline, norepinephrine. Here the dose is, starting dose is same 0.05, but the maximum dose is less, it's 0.15 microgram per kg per minute, and the formulation is 1 mg per 1 ml. Let's understand what this means. So it's like 1 into 10,000, like if there are 10,000 units, or what we can say 10,000 parts of a water line, there will be 1 part of adrenaline inside it. So you can guess it, like if we divide it in, there are 1001 parts, and 1000 parts will be fluid, solvent, and the 1 part will be adrenaline. So I hope I will be able to make you understand that. It's little tricky. Next is milrinone. Well, I don't know what is this drug, so we are going to study it together. It's phosphodiesterase 3 inhibitor. Yeah, we know that phosphodiesterase 3 inhibitor, inotrope, uses acute decompensated heart failure, short-term support in cardiogenic shock. It inhibits PDE3, increase cyclic AMP, increase cardiac contractility, decrease vasodilation. It increases vasodilation, so as a result decreases preload and afterload. So it's given in cardiogenic shock because it supports our heart. Side effects: arrhythmia, hypotension, thrombocytopenia. The dose of milrinone is, the loading dose is 50 microgram per kg over 15 minutes, and then maintenance dose, which is 0.25 to 1 microgram per kg per minute. and the formulation or strength is 1 mg per 1 ml. Next is adenosine. It is anti-arrhythmic drug class 5. Uses paroxysmal supraventricular tachycardia. Paroxysmal supraventricular tachycardia. That's interesting. What is paroxysmal? It's like something that's on and off, intermittent, like it starts and stops, not continuous. Supraventricular, starting from upper part of, from above the ventricular. So it may be, origin may be SA node or AV node. First line acute treatment, diagnostic aid in wide complex tachycardia. Mechanism, activates adenosine receptors, temporarily blocks AV node. Conduction, yeah, I was right about that. It restores sinus rhythm. So it's given in AV node tachyarrhythmia or tachycardia. Onset duration, onset is very rapid, in seconds, very short half-life, 10 seconds. Side effects, flushing, chest pain, dyspnea, lightheadedness, brief asystole, expected bronchospasm. Guys, that's all in this part. The remaining medicines and the doses we will study in the next part. Thank you for watching.